So, healthcare has really never had more ideas, more research, more technology, more solutions promising to fix everything. So, what is it that in a few years they either disappear or fade away or don't exist anymore? What it is about that? Hi, I'm Bruce Spurlock. I'm a physician and healthcare leader dedicated and committed to helping physicians and decision makers navigate change with clarity. On Viral Healthcare, we take a closer look at the ideas and innovations spreading throughout healthcare and what makes them work, what makes them fail, what's hype, what's reality, and how to make them work effectively for you. Today's discussion, we're going to spend a little bit of time thinking about and talking about what is it that helps you decide if it's hype or if it's reality. That's kind of the key question early on, trying to understand what are we going to use to be able to understand and be tempted by these bright, shiny objects. So that's really the issue. Now, let me set the context. Why do we even have to even be discussing this? There are very, very smart people in healthcare, both clinicians and administrators and people that have trained and have lots of experience. So what's the issue? Where does it start with? Well, the real problem is what I alluded to in the very beginning. We have an overwhelming input problem. There is a volume of issues and inputs and signals that come out people every day, hundreds of them, if not thousands of them, studies, research, vendors, product launches, AI, buzz, buzz, buzz. It's really out there continually. And the real challenge is if you want to, you can't. You can't evaluate each one of them like you'd like to. You can't go into deep enough understanding about what's happening. So what do? Well, the simple thing is you just take shortcuts. Like, for example, you rely on the reputation of the person who is promoting it or talking about it. Or maybe you assign a junior person in your organization because they have the time to evaluate it, but they don't really have the experience to pick up what's reality and what's hype. Maybe it's popular. Maybe there's a lot of people talking about it. Maybe it feels like everybody's doing it. So there's a speed or velocity thing we've talked about in the past. The idea is that the volume of inputs, the pressure creates vulnerability to hype. So good people usually making good decisions, but it's just overwhelming them. So what is it about healthcare in particular that makes hype work so well? I mean, other industries have this issue too, but there's something unique about healthcare. And I think it's sort of the nature of what we do on a day-to-day basis. So we have this pressure to act. That's fundamentally what we're trained to do as a physician. I was trained that in medical school. Acting looks decisive. Acting means you're taking action on a problem. If you're a hospital administrator, if you run a health plan, if you're in charge of a medical group, waiting is not rewarded. Watchful waiting is sort of a buzzword that people sort of say, no way. I have a friend, we were talking about prostate cancer, and we actually use this word watchful waiting in prostate cancer. You don't believe how many people struggle just using that word because doing something feels like you're being decisive and you're being rewarded. And that's kind of what leaders are supposed to do. Sometimes this idea is touching on a painful problem, something that's meaningful to you. It sounds modern or innovative. It sounds exciting. Maybe that the promise that it'll reduce uncertainty. So when something feels urgent, the question is, do we evaluate things differently than when we feel like we have some time? So let me go through what I think are some early warning signs of hype. Now, they're not 100%, but they get at some of the clues, some of the things to think about that will sort of maybe ask questions if this is hype or if this is reality. So the first one is when somebody or something overpromises scope. And I got to tell you, if I hear the word transformational one more time, so many things are transformational in healthcare. Everybody wants to be transformational, and yet very few things are. Very few things are transformational. Even things that come out from government mandates take years and years to have that kind of impact. But people promise that they promise to revolutionize. They promise to have enterprise-wide solutions, or how about end-to-end solutions? So when anybody uses those kind of big fancy words like, we're going to make a huge difference in your organization, that's rule number one, be wary. The second one is when people or when something promises speed without substance. Now, this is when I like to talk about the 90-10 slide deck rule. I don't know if you've ever been to a conference. No, you have. And you've gone to the conference and people are talking about this new idea, this new innovation, this new thing that they just did. And they spend 90% of the talk talking about the problem. Maybe the first half of it, this is why we have a problem. These are the features of the problem. This is where the problem came from. This is why the problem persists. So they spend a lot of time on the problem. And then they spend, sort of conceptual time on how they're attacking the problem. And that's probably the next 30 or 40% of it. And only till the last one or two slides do you get a hint that maybe they've done something about it, that there are some real solutions or real data or something that looks like impact or outcomes. So it's where there's a lot of, speed and a lot of activity and a lot of discussion, but there's really very little discussion on like success. So that's speed without substance. That's sign number 2. Sign number 3 is weak or misapplied evidence. What does that mean? Weak or misapplied evidence. That's when somebody like at Johns Hopkins says this worked for us. Or when somebody said, yeah, this worked in my small rural hospital, but it doesn't really generalize to other places. It's part of that 10% of the 90-10 that people don't talk about very much. It's not scalable. They're really looking at like case studies or one-offs or something that's more ad hoc, and it doesn't necessarily generalize really well. So there may be some evidence, but it's weak and misapplied at the time. So that's sign number 3. Sign number 4 is people don't spend a lot of time talking about implementation. They talk about conceptually how this idea, this innovation, this product, this new activity, this new method, this new protocol is going to work, but they don't spend a lot of time talking about like what was step 1, what was step 2, what was step 3. Sometimes you even wonder if the only reason it was successful was because they had this really charismatic, magnificent leader who's now on a bunch of panels and on a bunch of boards talking about their solution, but you don't see different types of leaders, different types of organizations. So there's about the pitch and not about the execution part of it. And in fact, we're going to talk a lot about on viral healthcare, how execution, implementation, really sometimes it could be a great idea that just fails because people can't really execute it. So that's the implementation. They just don't even mention it, don't get around to talking about it. The 5th sign is really this thing that we could do this additively. There are no clear trade-offs. So if something is easy to add, it's likely to be incomplete. Just add this on to your regular work. In fact, what people should be talking about is if you're going to be doing this, you should consider not doing something else. Maybe they don't get that specific about it for your organization, but it's looked like it's going to be layered on easily and have these great transformational solutions, and you're not going to have to rejigger or reapply or reorganize or reprioritize anything that you're thinking about in the organization. So those are kind of the 5 signs that I would start with. We'll go into more depth in future episodes, but overpromising scope, speed without substance, weak or misapplied evidence, a vague implementation, and not really specifying that there are trade-offs with implementation. So those are the signs. Let me give you a couple of real-life examples. Some of you may not be old enough to know about it, and maybe that's the point. But back in the 70s, there was this idea of a pet rock. You're not going to believe this, but a guy actually created a Christmas present for people to buy for each other where you would get a rock and a little like nest for it, and it would sort of be an emotional salve for you. It was sort of a way to deal with psychological stress or anxiety. And it was the #1 sale. Over 1.5 million pet rocks sold in the mid to late 70s because of that. And yet it doesn't exist today. That was clearly a fad. There are those kinds of fads every year. It feels like, Tickle Me Elmo was one. Every year there are these Christmas presents that sort of are rare and exclusive, but that are hyped to be the solution to everything. I think they even made a movie with Arnold Schwarzenegger called Jingle All the Way that was about finding that present for his kid. These kind of ideas, these kind of Christmas present fads, they're frequent. And what's the difference about it? Why would that not work in healthcare? It's because we don't think about things embedded into workflow. I mean, ultimately, everything has to be implemented in an organization. The workflow has to be redesigned. That has to be reorganized, reprioritized, and reconfigured along the way. And that's very difficult. That's some of the more challenging aspects for it. It may not solve a sustained problem. It may be something that's a one-off type problem or a temporary kind of problem that comes and goes. It could be that we have a new administration in Washington, and there's big excitement about certain areas, and then with the next administration, it goes away. So some things just are not sustained problems that we're trying to figure out. So now that we've talked a little bit about the hype piece of it, and again, I think we're going to dissect this even more in the future. Let me just give a really brief overview about some of the signs of reality, what reality and what something durable looks like. So it's where it's problem focused, and the problem is something that's been persistent and multiple attempts at it, but a new, different way of analyzing or thinking of the problem, something that's unusual. I hate this term, but it's out of the box, whatever you want to make of that. It's a way of thinking about it, challenges the assumptions that we had and creates a solution that might actually be viable. It requires an effort to implement. People aren't running away from it. They actually say, yeah, this is going to take dedication. In fact, I kind of think that when you talk about durable solutions, people should think about it in terms of years. Very few durable solutions get implemented in the first 6 months of an initiative. It often takes testing and refining and revising and those kinds of things to make it successful. It's often less exciting up front. In fact, the early part of the solution phase, the early part of the implementation, the early part of reality looks operational more than conceptual. And it really is like slow going. In fact, that's where you have to keep most of the energy going because the front line and other people in the organization can't see success. You might have painted a picture for them of what success looks like in your organization, but early on, it's a hope and a prayer that they're going with. So if you should be in thinking about a new idea in your organization, the results you should expect early on is friction. I know, it's painful. Friction does not sound like fun. It sounds like pushback. It sounds like resistance. It sounds like, we've got change inertia, all of those things that are very, very difficult in the process. But really, that's kind of what happens for the vast majority of them because you're kind of disrupting workflow. You're disrupting what they expect. You're creating more uncertainty along the way, especially early on. So the first thing you should see when you're trying an early rollout is friction and maybe even a little bit of failure. And so trying to prep your organization, your team to anticipate, to sort of expect failure, to expect you're going to have to rework things several different times, that it's going to be bumpy along the way before you get to the success is going to be important. Second thing really want to think about is gradual improvement, not immediate transformation. So that's the reality where people talk about transformation, changing your organization. I think about that over 3, 5, maybe 7, 10 years in time. That's a long time. Most people don't have the patience for those kind of transformational activities to occur. But really, that's what we're talking about. It's evolution, not revolution. The next thing you should think about is seeing variation across teams and units. And this is universal. Some places in your organization will adopt things more quickly and easily than others. And some places will have resistance more than other places. In fact, that's a clue, and we'll talk about why you choose those places for implementation, but variation is to be expected. And so thinking about how you're going to implement a big idea, something revolutionary or more like evolutionary, you need to think about how it could spread and where that goes from it. It's usually early on, it's really messy. Messiness is actually a good sign. You have to prepare and understand what chaos and how to manage chaos. That's something I think we'll talk about in the leadership aspects of this podcast in the future, but that's something really helpful to think about. So here's a really quick checklist for you to go through when you're considering or thinking about a new idea, a new innovation, a new protocol, a new method, a new paradigm shift, whatever you want to talk it. First, look at the problem that it's actually trying to solve. And that's really the first clue. We're going to talk in the future about how some companies are solution oriented rather than problem oriented. And this is really key to thinking about problem sensing, problem oriented, seeking failure versus trying to seek solution first. The second thing to look at is to see what's going to take for this to happen operationally. What are we going to have to reorganize, reprioritize, rework, redo, undo, break, put back together, and it's going to be difficult along the way. The third thing is, what are we stopping to make room for? And I can't tell you, I've seen so many big, massive organizational changes, and I've asked leaders, so what are you not doing? And they usually don't tell me anything, but in reality, they are. Their eyes are taken off from other areas in the organization, other areas that were priorities just a few months ago, maybe last year's priorities, and suddenly we're doing this big thing. And so we add a new priority rather than stopping something else. Be explicit about it. Say, we're going to stop this and start something else, and make that conscious decision. In fact, if you do that, it slows you down to make the opportunity cost trade-off. We're going to spend some time about what are those opportunity costs, because it's a key part of good decision making with it. And then think about what success really looks like in the first 6 to 12 months. Probably not going to be as pretty, probably not going to be as desirable. You should hopefully see some green shoots, maybe of early telltale signs that you're getting success and things are breaking through. That first phase, oftentimes the success is delayed for at least that long and sometimes longer. So whatever you do, just think about asking yourself those questions, and just the process of stopping to ask the questions will help you make better decisions. So if any of this session resonated with you and you're looking at the next big idea that may be coming your way, pause long enough to ask those questions. Pause to sort of widen your possibilities of how you might use your time, use your investment energy in the organization, both in people and in treasure and in attention. And just think about what it is before you jump in. We have a lot of volume, a lot of inputs, a lot of places that are telling us act, act, act. And acting by waiting, acting by thinking is acting. It is a decision. It is being decisive. It is being a leader. It's just not as rewarded as doing something, but it is equally as important. So think about that. Now, if you'd like to continue this conversation on these kinds of topics in the future, join me for this LinkedIn Live every Tuesday at about this time. And follow Viral Healthcare on your favorite or your preferred podcast platform. In the next episode of Viral Healthcare, it's going to be kind of fun. I'm looking forward to this, and we're going to talk about how to look at trends systematically. What is a mechanism to think about? How can you sort of systematically? We gave a couple of hints on this session, but what kind of system can you adopt? There are several out there, and I'm looking forward to talking about those a little bit more to make it easy for you to be able to do this. Not something that depends on experience or being, through a lot of wars with all these different things, but something you can actually adopt in a regular way. So I want to thank you for listening to Viral Healthcare. If this conversation was helpful, share it with a colleague who's navigating change. And if you like more thoughtful conversations about ideas shaping healthcare, be sure to follow the show and give me those ideas. I'd love to see your ideas about things that did work, things that didn't work, and things that you actually stopped because it was creating a problem with your organization. I'm Bruce Spurlock, and I'll see you next time.